Bismillahirrahmanirrahim. My name is Yasser. I'm making my second video related to current pandemic condition of COVID-19, which has unfortunately affected almost all the countries around the globe, and they're trying their best to cope with this condition. There's a lot to talk about this condition, but I will try my best to cover only few aspects, which will be related to the diagnosis, the management, and the prevention. Related to the diagnosis, I think there are two aspects to diagnose. One is the clinical presentation, and second is the lab diagnosis. For the clinical presentation, if someone is having high grade temperature, cough, body aches, loss of taste and smell sensation, and having the travel history from the areas with the high number of positive cases, should be considered as high risk for COVID-19 patient, and such patients should be isolated, preferably at home, and they need to keep on monitoring their symptoms, including chest pain and breathlessness. Also, to look if they develop any bleeding from their in sputum or in their spit. Apart from that, they need to continue their sportive management, which will include well hydration, paracetamol for body pains and the temperature. And if they want to take anything else, the vitamin C can be considered, as many developed countries they have included vitamin C as their in their treatment plan. Now, the other aspect of the diagnosis is the lab diagnosis, and the gold standard for the diagnosis, which is currently in use, is RNA PCR from the swab of nasal or oropharyngeal mucosa. Imaging, including chest X-ray and CT scan, they are playing a major role in it. Chest X-ray can show bilateral infiltrates. CT scan are showing ground glass appearances. There are few cases in which they are doing the CTPA along with the high D dimers, as there are few cases which have reported to have thrombosis in their pulmonary vessels, and they are giving them as the anticoagulations. Now, the patients, around 85 to 90%, they do present with the mild symptoms, which I mentioned earlier, and they can be managed with the sportive care at home. Importantly, they need to watch their symptoms related to breathlessness, chest pain, or bleeding from their sputum, or if they spit any blood. The next category of patient, which is comprising of around 10 to 15%, they need hospitalization, and they do class as moderate to severe, or from severe to the critically ill patients. In the hospital, the main requirement is the oxygen. Apart from that, there is no specific treatment for COVID-19. Yes, there are a lot of studies going on. About 440 studies are going on, out of which 280 are the clinical trials related to the medications like hydroxychloroquine, azithromycin, interleukin 6 antagonists like tacozumab. Importantly, there's interesting study going on, which is the extraction of the antibody from the plasma of the cured COVID-19 patients, which will help in the preparation of the vaccine. And the outcome of all these studies will be appearing from September and then onward. In my country, in Pakistan, there are two important studies going on as well. One is related to the hydroxychloroquine, and one is the extraction of the antibody from the plasma of cured patient. I will suggest here that the patients who are in the hospital with the diagnosed cases of the COVID-19, if the clinician or my fellow colleagues are giving them any of the treatment like azithromycin and hydroxychloroquine, they are widely available. Please try to register these patients into those trials. Now, from the prevention point of view, I think the community, is the key to prevent the spread of this condition. As I mentioned in the beginning of this video, self-isolation with the mild symptoms is important because it is so infectious. Even someone with the mild symptoms but having the COVID can be spread to the other people. So self-isolation, keeping social distances, Washing hand frequently, using the gloves, using the mask to prevent to touch the surfaces, because the obviously, as I mentioned, there are 440 studies going on. They are talking about for what is the life of the COVID-19, for how long it can stay on the surface, and so on, so on. So I think we should be focusing on the few things which I will briefly summarize in two, three sentences. One is look for the symptoms. If you develop mild symptoms or light symptoms, stay at home. If watch for your breathlessness, chest pain, then go to the hospital. In the hospital, there is no defined treatment for this condition. Yes, a lot of trials are going on. Hydroxychloroquine, azithromycin. If you're trying them, please try to register the patient in the trials which are going on. And the prevention: frequent hand washing, use of face mask, use the gloves, social distances. Social distance mean around 6 to 12 feet, which is equivalent to 1 to 2 meter of the distance. Stay blessed, stay safe. I hope this video is useful. If you will watch in this period of quarantine, and when there is a lockdown everywhere, please look around people who are suffering from this lockdown and help them as much as you can. I can be contacted via my email or WhatsApp. I will try my level best to help you guys as much as I can. Thank you very much.